This video is about cataract surgery, and it's from a patient perspective. This is part 2. This is the actual surgery. Part 1 was the pre-surgery details. The question is, why would you watch this video? And the answer is, you're curious about cataracts and you want to know about intraocular lens surgery. I am an IOL surgery patient. I've had 2 different doctors, 2 different hospitals. The left eye had successful surgery. The right eye had the most common fail. I'm going to cover in this video how I knew I had cataracts. I'm going to do a layman's summary of the surgery basics. I'm going to talk about the right eye pre-surgery summary. I go into detail on the first video about this. Right eye surgery, and this is the one that had issues. This side had issues. Left eye pre-surgery summary, again, that's from the first video. And left eye surgery, this one went to plan. And then I'm going to do a summary of the differences between the 2 doctors and hospitals. I'm going to use this format because, well, there's a lot of stuff to cover. It's important, and I don't want to forget things, and I don't want to waste your time rambling and saying, forgetting stuff. So let's get started. First, disclaimer, I'm not a doctor. I'm not medically trained. This is not medical advice. I'm sharing my experiences as a patient. Always get your medical advice, diagnosis, treatment from your doctor, not from me, and certainly not from the internet. All information is offered as is, no guarantee on correctness. Things change over time, so yes, you can use at your own risk. First of all, how did I know I had cataracts? Well, my nearsightedness, myopia, required new glasses after 6 months, and I had a full diopter change in that time period, which if you wear glasses, that's huge. The optician, he's a technician, said I might have cataracts, so I went to the doctor, an ophthalmologist, and the ophthalmologist confirmed it. Cataracts are a change in the lens eye, in the eye's lens. If you're a doctor and you're looking through one of those instruments, this is what a cataract looks like. It's cloudiness. The symptoms per the Mayo Clinic, and that's a really excellent source of medical information, is the Mayo Clinic. Clouded, blurred, or dim vision. Yes, I had that. The ones with the check marks I had. Increasing difficulty with vision at night. Oh, yes. Actually, I was blind in my right eye at night. I couldn't see anything. Sensitivity to light and glare. I did not have that issue. Need for brighter light for reading and other activities. Yeah, I laughed because, the lights were just ridiculously bright. Seeing halos around lights. So, yeah, I was having that problem. So street lights and traffic lights and car lights and all that. Frequent eyeglass and contact lens prescription changes. Well, yeah, that's what I said up here. Fading or yellowing of colors. Well, it happened to me, but I never noticed it. you can see this picture over here. This is kind of a simulated change. The sharpness changes and the color changes, or a brownish brownish yellowish shift in color. And double vision in a single eye, didn't have that one either. The surgery begins with this angled incision, and they're going to do all the work through here. And when it's over, it ends with the natural pressure inside of the eye, closing this without the need of sutures or anything like that. The work is going to center around this yellow oval. This would be the capsular bag, and I've enhanced that with a yellow line because otherwise it's pretty much invisible. This is the natural lens that's in the eye, and the surgeon will go in there and slice that up and remove it through this incision. And then when they are done with that, they will remove the front of the capsular bag, and finally they will insert the lens that looks like this in through that opening and position it carefully, and then you can see that going on here. Let's talk about doctors and appointments. This is a summary from video 1. This is my first visit to the surgeon. What did I do to prepare? I did nothing. I did no reading. I did no research. I showed up. She did an ordinary refractory, an eye measurement using this type of device. Eye checkup. So she looked for diseases that might disqualify me for being a surgery patient. She gave me the cataract diagnosis. We discussed the basics on IOLs, the types, how the correction works, and the price. And then we did a appointment for the next visit. And so the next visit, She took extended measurements and photos. She tested for tear duct drainage to the sinuses. So they put a tube into the corner of your eye, inject salt water, and make sure it drains through your sinuses, so that's all clear. She did ultrasound versus optical scans to take the measurements from my eyes, and they used that to determine the amount of correction needed for the artificial lens. We decided on a preferred focal distance, and I selected a monofocal IOL. I signed the legal no-sue waivers, and those are very strict. There's just no suing. I paid half the price, and then we discussed what to expect the day of the surgery. So for example, she said she was going to put a needle into my eye and to deaden it to make sure it didn't move around. She gave me the choice of being awake or asleep. Anesthesia costs more and takes longer, so there was that. Post-op instructions, so she went over no water in the eyes, the hair cleaning, you have to be really careful, showering, use of eye drops, swimming, heavy weights, etc. So she gave me 4 sets of eye drops to start 4 days prior, and then told me to come back early on the day of surgery. Right eye surgery. I arrived at 0600 in the morning, yes, checked in, they did the basic health check, temperature, blood pressure, all that stuff. I signed new waivers, yeah, so more no-sue waivers. I promised to pay the balance of the costs, plus any fees for complications. Now, a lot of doctors don't talk about this, but if something goes wrong during surgery, or if your eye's not what they expect, or yeah, just anything goes wrong, you get to pay for that. In most cases, that's not part of the fee. Good doctors can handle these complications. That doesn't mean that you're not going to pay for it, but they may have to spend an extra few hours working on you if something is not as expected. So yeah, about 7 o'clock I was taken to the changing room, and I moved from the street clothes, the hospital gown, cap, and underwear, put on the gurney and wheeled into the post-op area, which looked a lot like that. The nurses began multiple eye drops, saline, betadine. Betadine turns your vision brown. Antibiotics, anesthetic, and dilation, which of course dilates your pupil, makes it hard to deal with bright lights. And it was about every 10 minutes. I lost track of time, to be honest, so I'm not quite sure how long each iteration was. And that continued for about an hour. The doctor came in and made 30-minute checks on the eye status, on the dilation. Then she marked the eye for surgery, so they put like a piece of tape over the eye and they say this one right here so they don't confuse it. The doctor gave an immobilizing injection under the eye, so it was under the eye, not in the eye. And then the drops continued for another half an hour maybe, and then she tested for immobility, and then gave the okay for surgery. Then I was wheeled into the operating room, and the doctor taped and bandaged my left eye closed. Because your eyes move together, yeah, they have to make sure that they have to do everything they can to make sure they don't move. So she closes this eye up, and then she placed cloth wedges behind my ears and bandaged my head to the table, literally wrapped my head to the table. They covered my face with a surgical drape, so there was a hole over this eye, and the rest of my face just had like a tablecloth or something over it. Then she asked the nurse to get the IOL. The nurse reads my name off, and I confirm that yes, that is me. She instructs me not to move at all. Eyes, hands, feet, fingers, nothing. Don't move at all. And then she also said, if you're going to cough or sneeze, tell her, because she has to prepare for that. She put a translucent tape with a hole over this eye, so that like this, and then left a hole in it. And then she moved the ophthalmic operating microscope into place, and it has a very, very bright light. I mean, it causes your eye to hallucinate these colors like something from the movie Fantasia. There's just one doctor and one nurse, and at this point, I can't really tell you what's happening firsthand. I can just go by what they tell me, but I mean, literally the images were psychedelic. They were just unbelievable. Yeah, it's very strange. So then the doctor used a special scalpel to make a 2.75 millimeter clear corneal angled incision into the side of my cornea, so like this. And she inserts and uses an ultrasonic wand to break up the natural lens, like we said earlier, and the front of the capsular bag. Then she removes the lens in pieces through the incision, so they take it out one bit at a time. And this is where the capsular bag was cleaned. The doctor from my right, I didn't do that. She inserts and positions the IOL, which is this right there. She makes final checks because this thing has to be in 3 dimensions. It has to be correctly oriented in the eye or there's problems. She announces a successful surgery, unbandages my eye, my head, and then puts a plastic cover over this eye. First she bandages it and then puts a plastic cover over it. The whole thing was about 20 minutes, and I literally had no feeling as to what was going on. I had no idea somebody was touching my eye or anything during any of the procedure. I could see out of my left eye, but I was snowblind in my right, which is normal. And then I was wheeled back to the recovery area for a time, so maybe 30 minutes again. I lost track of time. I was rechecked and taken back to the dressing area and got my street clothes back on. They made an appointment for the next day, so that's very typical. The doctor will want to see you the next day, make sure everything went right. I was given instructions and eye drops, so the main thing is no water in the eye. She emphasized that over and over and over again, so like dry shower or sponge bath. She instructed me on how to redo the eye patch before bed, and she had this method of wiping the eye 5 different ways: the lower eyebrow, upper eyelid, corners of the eye, eyelid, lower eyelid area, and then cover it with a gauze pad and tape shield. So yeah, of course do that with whatever your doctor says. So right eye surgery, I was done. I took a taxi home at 11 and that was it. So let's look at the left eye surgery, which had a different doctor and a different hospital. This is the pre-surgery summary from my first video. And for the left eye visit number 1, I did lots of research. Yeah, because the right eye didn't go so well, so I wanted to make sure I was on top of this. Went in, the doctor did an ordinary refractory, eye checkup, so on. Got the cataract diagnosis. He did detailed scans and measurements using some rather different equipment. And that would be verified later on with laser interferometry during the surgery. The discussion we had a discussion on IOLs, focal range, my lifestyle. I had this all written down. I was ready to go. I knew what I was going to talk about and what questions I had. I had a retinal tear, and he did a peripheral photocoagulation of that, and then I paid the bill. He'd give me lots of homework. So for visit 2, I did a lot of research, and I had decided on the extended range monofocal. It costs a little bit more, but yeah, it gives you a little bit better range and focus. I had decided on the 45 centimeter range for reading, computer distance, that type of thing. So it's like 1 foot to 18 inches. And that would make me nearsighted in that eye, and frankly that's what I've been all my life, so it was no big deal. So I went in for visit 2, and he did an ordinary refractory in the eye measurements. He did detailed scans with some other equipment. He checked his retina repair. He took measurements for the IOL, and I discussed the IOL decision with him. He did not talk about going under anesthetic. Yeah, because he doesn't recommend that, so that's that doctor. We discussed the future exchange of the right IOL, so because these 2 eyes are going to be different, the left eye is going to be nearsighted and the right eye is going to be farsighted. If I couldn't live with that, he was talking about exchanging the right eye IOL. We discussed the surgery, the laser interferometry, so he would remove the lens. They would shine this light, this laser in there, which develops a pattern in your eye. And from that pattern, they can make extremely accurate measurements on what's going on inside there. Yeah, he talked about laser scalpel versus mechanical scalpel, and he recommends mechanical scalpel. And from what I've read, yes, that was a good suggestion. He talked about hazards of infection and so forth. I paid 100% of the cost, which is about 3 times more than the right eye, and that again does not include unforeseen complications. He gave me 2 sets of eye drops, and that was to start about 2 weeks prior, and it was an antibiotic and an anti-inflammatory. And then we did set up the schedule for the pre-surgery, surgery, and post-surgery. So the day of the surgery, I arrived about 7. I was taken to the changing room, and I went from street clothes to the hospital gown, cap, and underwear, put on the gurney, and wheeled into the post-op area. They connected me to a heart, blood pressure, pulse monitor, all that stuff. And unlike the first hospital, they didn't remove this. This was with me the whole time. I was under constant watch, and I had multiple eye drops about every 15 minutes. Again, that's an estimate because I can't be sure. I didn't have a clock or anything. The doctor made a check on the eye status after about an hour, and he marked the eye for surgery. So again, the tape and the marker. There was no immobilizing eye injection, thank goodness, because I don't really like needles, especially around my eye. And then they continued the drops for maybe another half hour, and then the doctor came in and gave the okay for surgery. At that point, I was wheeled into the operating room, and there was one doctor and about 4 to 5 nurses and assistants. They confirmed my name as usual. They asked me to confirm who I was. The right eye was bandaged closed for the same reason as before, to keep the eyes from moving. The doctor placed my head in a U-holder. So instead of these like hard pillow-like things that the other doctor used and bandaging my head, it's a U-shaped holder. They set your head in there. It's like a soft clamp. My face was covered with a surgical drape with a hole for the left eye. And then they placed like a rubber dam around my eye, and they filled that with a fluid. They brought in the microscope and they moved it into place, and the light was switched on. It's not as bright this time as it was the first time. He tells me to hold still and to tell him if I'm going to sneeze, cough, or anything like that. The light is bright, but I can still see images moving around, and occasionally they add fluid to the pool, and it's cool, so I can feel that happening. So again, I can't tell you firsthand what's happening. Everything else is based on what I was told was done. So again, no pain, no feeling, nothing. The doctor uses the scalpel to make a 2.75 millimeter clear corneal angled incision in the side of the cornea, same as before. Uses an ultrasonic wand to break up the natural lens in the front of the capsular bag, again, same. He removes the lens in pieces through the incision, and again, that's the same. This doctor, though, he cleaned the remaining backside of the capsular bag. So you can see over here, this is my right eye and my left eye, and you can see this looks like nice and sharp, but that's not what we're looking at. We're looking at this black hole right here, and you can see it's very clear. This eye, even though this part's blurry, what's happening is the camera is focusing on the back of the capsular bag, and you can see this junk in here. So in the future, I'm going to have that lasered out of there. Okay, so he cleaned the capsular bag, and he uses the laser interferometer to check the manual IOL correction calculations, and this is where I'm seeing all these red patterns. He asked me to verify my desired target distance. He selects the necessary IOL from his box of IOLs, and then he inserts that into my eye and positions it. Then he does a final measurement and checks to make sure that IOL is in there correctly in all 3 dimensions. He places a bandage and eye cover over my left eye, and I can see out of my right eye, but I am snowblind in the left. So I'm done in about 20 minutes. I'm wheeled back to the recovery area for a time. I can't remember how much time. Again, there was no clock there. I was rechecked and then taken back to the dressing area to change into street clothes. I was given further instructions and eye drops to take home. Again, the instructions: no water in the eye, no swimming, sauna, heavy exercise, and so forth. Take a dry shower or sponge bath. At nighttime, I was to redo the eye patch before bed, wipe the eyes down per their instructions. It was similar to the right eye, but less involved. And then I was to use the iPad and plastic shield at night. During the daytime, I was to wear these provided safety glasses like you would buy at your Home Depot or something like that, hardware store. And that's to keep dust and any impacts out of the eye. Make an appointment for the next day, took a taxi ride home, and that was it for the left eye surgery. So the differences between these 2 surgeries, the left eye had more surgical options: the laser scalpel, the laser interferometry, the capsular bag cleaning, the lens exchange, and the right had none of that as an option. The left eye, he cleaned the capsular bag. The right eye, no, it did not happen. Again, it wasn't even an option. The right eye, I had the immobilizing injection under the eye. Left eye, not, thank goodness. The right eye was a longer process, longer recovery, but not a whole lot. The right eye, they used betadine drops, which leaves you with brown vision for a while, just hours, not like all that long. The left eye, not. The right, the head was blocked and bandaged down to the table, which is, if you're claustrophobic, that's kind of yeah. The left, minimal constraint, drape in the eye pond, which again, the eye pond they did not have. My actions before surgery, on the left eye, I chose to cut my hair very short so that keeping my hair clean was easy. The right, I did not, and it was very inconvenient to wash my hair for a couple of weeks. I ended up laying on the shower floor and keeping my eyes closed and basically just rubbing hard with a wet washcloth. And for both, I chose not to eat or drink before surgery. That was to prevent having to go to the bathroom in the middle of the procedure. The actual surgery was the simplest part of dealing with cataracts for me. I mean, you just laid there and they kind of did everything to you. There was no pain, nothing. Okay, so those are my experiences in the surgery phase of having IOLs put in. I'm producing videos for each of the phase. Video 1 is about pre-surgery. It's out there. This is video 2 about the actual day of surgery. Video 3 is on post-operative care, what I had to do afterwards. And video 4 are things that went wrong with me and also they can go wrong in general. And finally, as always, my best wishes that everything works out well for you.